right, you're live.
Hi everyone. So we're moving on to our next part of our treatment for our patient. So we started with the air lace, and then we did the air lace on the face and neck, both the front and the back of the neck, and we did his back. So why we did it on his back is it's great for hair removal and it helps with any active acne. So now we're moving on to our second portion of the treatment, which is the Clear+Brilliant. So you can think about Clear+Brilliant kind of like your very aggressive facial and a very mild laser. So the downtime with this is 1 to 2 days. What's primarily going to last you a few days is going to be that sandpapery texture, but nothing that anyone on the street is going to notice. Only you're going to be able to feel it when you touch your face. So we're going to get started with the treatment. So this is the Clear+Brilliant, and this is the Premiere handpiece. So this is going to be targeting mainly hyperpigmentation, but it also helps with a few other skincare concerns. So pore size, fine lines and wrinkles, active acne, tone and texture. So it's kind of your everything laser. So he really shouldn't be feeling too much. We can also use a fan for this, so kind of makes the treatment a little bit more comfortable. Do you want me to grab that for you?
No, I'm good.
Good. So the noises that you're hearing is just the laser being triggered. So you can either go fast with it or slow with it. Doesn't really make so much of a difference. This will not get rid of hair, but if you do have, for example, eyebrows filled in, such as microblading, you do want to tell your provider to stay away from that because, like I said, it does pick up on pigment, so it will get rid of that. This treatment is great to do once a month for maintenance, and since the downtime is so little, it's such an easy treatment to do. You can do this in combination with a lot of different treatments. So like I said, for today we're doing this in combination with the microneedling. We're going to be using the Emer microneedling device, and then we used it with the air lace as well, and then we're going to be ending with the Enlighten peel. We also use this in conjunction with a bunch of other lasers or treatments. So if we were to do like microneedling with radio frequency device, such as Morpheus or Fractora, we could do this first, and then we'll do the Morpheus or the Fractora after. So whenever we do our combination treatments, we always want to start with the less ablative treatment and move on to the most aggressive.
Why do we do that?
Because, for example, if we were to do a microneedling treatment on him, we would have broken the surface layer of the skin, and we don't want that to be broken yet. We want to first do the Clear+Brilliant, which is targeting the surface of the skin, and then move on to the underneath layers of the skin. So as you can see, our clinical endpoint is some redness. So this redness over the course of a few hours is going to, you're going to see these little tiny scabs that's going to come over the area. Like I said, people won't notice it, but he'll feel it. So when he does that, he's going to feel it. So you're going to want to treat your face very, very nicely. So that means no using any exfoliating scrubs. You're just going to want to use a gentle cleanser. So what can happen if you use an exfoliating scrub, or if you know, I know a lot of you do it, I do it sometimes too. When you wash your face and you want to dry it after, you'll like rub your face like crazy. You don't want to do that. You want to pat dry your face because that rubbing, that friction is going to cause the scabs to come off, which can be more damaging to the skin. And then it'll do the contrary effect, which is cause more hyperpigmentation. So you want to treat your face like a baby's face is what I always say. You okay?
Mm-hmm.
So this is also gonna, again, be helping these little pores he has here, the pores on the nose. So why is that good? So the smaller the pores are, the less chance that the debris of just normal daily life is gonna get in there, the less chance that bacteria is gonna collect in there and cause the pores to widen. So that's why it's also good to get exfoliating facials. So we have the salt facial here. That would be a great treatment to do beforehand to just clear out the pores, and then to do a laser treatment on top of that. So since there's not going to be anything in there, since we took it out, and then we do the laser treatment, it's going to help to just really close it up.
What other treatments are good to combine with this one?
So you could do like vascular lasers with it. So let's say if the patient had any like broken capillaries around his nose or anywhere on his face, we could do that treatment. And then we could do this. Microneedling, which is what we're going to be doing today. Honestly, Clear+Brilliant is a great treatment to pair up with any of our treatments in office. Like I said, you want to do this once a month. And if you at least do once a month for 3 to 6 treatments, and then after that just do maintenance treatments just to keep up the skin. This is just helping to get rid of the first few layers of the skin. So you're gonna have little micro peeling to the cellular level of the skin. So not really peeling that you would be able to see. But since he's gonna be doing the enlightened peel, he's definitely gonna be seeing some peeling going on.
How often are the maintenance treatments afterwards?
Once every 3 to 4 months. Why it's also good to do, for example, a facial or a salt facial before this is because you're going to be getting rid of that first layer of dead skin. So when you go over with a laser, or when you want to do any of our peels such as the Enlighten or Cosmelon, the laser and the peels are going to be able to penetrate even deeper, and it doesn't have to go through layers of dead skin. So again, you can see he's reaching really good clinical endpoint with the redness. So also with this laser, why I love it is a lot of men love to keep their beards, but this laser is safe to go over the beard too. So again, it's going to be helping with hyperpigmentation, tone and texture, fine lines and wrinkles, pore size. You want to do this if you can once a month for the first couple of treatments, and then do maintenance treatments after that. It's great to pair up with other treatments such as microneedling and PRP, and then doing a peel on top of it. If you want to pair it up with microneedling with radio frequency, we can do that as well. Does anyone have any questions for me?
What's the pain level?
So we numbed him up, so he shouldn't really be feeling much at all. But if he wasn't, it's just going to be feeling very like tingly sensation. Not too bad, but it's not comfortable. As the treatment goes on, they start to feel like they're getting a little bit of a sunburn. But since it's a pretty mild laser, the pain tolerance is not bad. I've had people who have done it without numbing, though I don't recommend it. Because why not just be comfortable?
Mm-hmm.
So we're going to continue on with this, and then I will see you guys in about 10 minutes as we start the microneedling and then doing the peel. See you soon.